We are so excited to have each of you join us today as we discuss our new report on the health impacts of extreme heat and wildfire smoke by the Bree Collaborative. My name is Emily Noodleman, and I am the Director of Implementation and Outreach at the Bree Collaborative. During the presentation today, we'll provide an overview of the report and the Bree, hear from some individuals representing different audiences within our healthcare ecosystem on how they intend to implement or working on this as we speak, some of the guidelines in our report and how they're doing that in their own roles. We will then, at the end of the presentations, transition to a Q&A. At the bottom of your screen, you should see a box that says Q&A. Please place your questions there so we may review and ask them to our presenters during this time. The webinar today is being recorded, and we plan to send out the slide deck and recording to you all who signed up to attend today via email. The recording will also be posted on our Bree web pages. As an introduction to the Bree Collaborative, each year the Bree develops reports on key health topics facing Washingtonians. Our members identify healthcare services with high variation in the way that care is delivered, that are frequently used but do not lead to better care or patient health, or that have patient safety or inequity issues. For most topics, we form a work group of subject matter experts and leaders to develop evidence-based guidelines. The guidelines take into account existing quality improvement programs and work done by other organizations. Our reports provide guidelines for multiple audiences, such as clinicians, health delivery systems, plans, public health, and others to encourage collective action to promote optimal health for Washingtonians. Again, our report is focused in Washington. However, we see that it could be utilized anywhere in the nation. I know we have some people from out of state joining us, and we welcome you to also use this report. We'll just be using examples from our state, as the Bree Collaborative was again created through the Washington state legislation, and we serve Washingtonians. The Bree Collaborative forms these work groups to bring together individuals across the state to engage in a work group, providing their expertise and help crafting these lovely reports. We greatly appreciate our work group members' willingness to share their time, knowledge, and expertise with us. And today we look forward to hearing from some of them, sharing the report with you all. We hope by the end of the meeting, you will leave with greater knowledge of the Bree Collaborative and our report on health impacts of extreme heat and wildfire smoke. Today, we are fortunate enough to hear from Dr. Chen from the Healthcare Authority, and who was also kindly our work group chair over the past year. Dr. Stefan from University of Washington, Sara Warner from Community Health Plan of Washington, and Onora Lien from Northwest Healthcare Response Network. So I will pass it to Chris and invite him to come forward to talk a little bit more about what is our report and how was it kind of created and what's all in it.
Great. Thank you so much, Emily. Hi, everyone. My name is Chris Chen. I work as a medical director for Medicaid at the Washington State Healthcare Authority. I just want to start off with some appreciation for the Bree Collaborative for sponsoring this topic. It has been a really important topic to be discussing over the course of the year that we've been reviewing and diving deep on this area. We've seen a number of different extreme heat and wildfire smoke events come up throughout the country. And so, as you know, we were reminded multiple times over the course of the year how important this work is. There have been unprecedented wildfires in the Mid-Atlantic region, in New York and New Jersey, of course, the recent wildfires in LA, and ongoing heat events throughout the country. And so this really is an opportunity for Washington to be leading in terms of how the healthcare ecosystem should be addressing the threats of climate change. I also want to really express appreciation for the Bree staff, including Emily Noodleman and also Beth Bojkoff and Kari Nicholas, who did a lion's share of the work in driving this topic forward. So thank you for gathering all of us around the table. As many of you know, with regards to background around this issue, one of the more seminal events that kind of lent urgency to addressing extreme heat and wildfire smoke was a heat dome that happened in 2021. At that time, the 126 Washingtonians unfortunately died as directly related to heat-related causes, probably more that were not kind of discreetly identified as such. We did see excess mortality higher in the state during those weeks compared to other weeks in previous years. And at that time, the regional temperature was 30 degrees warmer than the average of the hottest 3 months in the previous decade. We know as climate change progresses that things are going to continue to get hotter. With higher temperatures, there's also the increased likelihood of wildfire and also subsequently smoke exposure as a result of those wildfires. Wildfire smoke exposure itself can increase all-cause mortality, impacting respiratory health, and as well as interacting with heat exposure to directly affect cardiorespiratory morbidity and mortality. Excess heat impacts emergency response systems. It increases ED visits for acute heat illnesses, increasing 911 call volume, and also has significant costs to the healthcare system. And we know from an equity perspective, while everyone is susceptible to increased heat, it doesn't impact everyone in the same ways. Certainly more vulnerable populations bear disproportionate impact, including young children, pregnant women, older individuals, people of lower income status who may reside in urban heat islands, as well as those who work outside. So there's a significant equity component to this issue as well. On the next slide, we talk about our aim for the report, which was to reduce morbidity and mortality related to extreme heat and wildfire smoke, with a special emphasis on planning and preparedness, knowing that right now it's not all that hot, and it's kind of funny to be talking about this issue on a snow day, but we do know that climate change can cause extreme weather events in both directions, and now is kind of the optimal time to be preparing and thinking about coordination in anticipation of what we know is going to become and has become kind of a recurring event every summer now. So we know that heat-related illnesses and health impacts due to poor air quality can be prevented or reduced or mitigated by implementing evidence-informed coordinated efforts across sectors, things like early detection and warning systems, education and communication, and standardized protocol for response. On the next slide, we talk about 5 themes that you'll see throughout the report, 5 different focus areas. The first of which is education across all different audiences. We all kind of have a responsibility to be providing education to each other and to the people that we serve, with public education, as well as more targeted efforts that are tailored for specific populations that are at risk. We have opportunities to improve health professional education on how to prevent, identify, treat, and manage heat-related illness and exacerbations of illness related to wildfire smoke exposure. From a planning and preparedness perspective, there's a lot that we can be doing. For example, coming up with action plans, educating staff and facilities on how to prepare early, given that it is such a commonly recurring event now. How do we think about monitoring, heat waves? Actually, from a weather perspective, are fairly predictable compared to things like the path of a hurricane or whatnot. And so, how do we take advantage of that and think about how we coordinate response and preparation using more systematic monitoring? From an equity perspective, there's a lot of information and literature, much of which we cite in our report, about which populations are at highest risk of negative health impacts. I mentioned some of those already, but how do we think about also allocating resources to those communities that are most impacted by heat and wildfire smoke and partner with those communities? From an incentives and investments perspective, there are many different ways that our financial systems can be tuned to help with adaptation related to climate change. For example, how do we think about sustainable operations of public health level interventions, think about investments that payers and other partners should be making in infrastructure and services. And then finally, from a tracking and measurement perspective, how do we integrate data sources that are used to identify high-risk population and think about some of those arrangements that facilitate a further understanding of the impacts of heat and wildfire smoke? On the next slide, there's a number of different audiences for our guidelines, and we had a lot of representation from these different partners throughout the course of our work group as well, which we just have lots of appreciation that there's so many people who are focused on this topic in our state. From the state agencies, we have intended audiences and had representation from the Healthcare Authority, Department of Health, Department of Social, Human Services, and Labor Industries. From health delivery systems, we had hospitals and emergency departments, emergency medical services, pre-hospital healthcare, as well as a number of other types of providers who we think the topic is relevant to. Health professionals, we had representation from clinicians, administrators, as well as other staff, health plans, employer purchasers, local public health jurisdictions, schools, and the legislature, a big supporter of the Bree collaborative work, and regularly thinking about some of the topics that come out of it. So now I think I'm turning it over to Dr. Wheat to talk about how clinicians and health systems could use this report.
All right. Hi, everyone. Very glad to be here. So yeah, as Chris mentioned, first, I'll also just thank the Bree Collaborative for hosting this, and also thank Chris for leading the charge on this work group over the last year. I know it's a lot of work, and I appreciate his leadership. So I'll say that I'm an emergency physician by training, and my focus is on the intersection of climate change and health. Heat being one of the most dangerous climate-driven hazards for health. And the drive of much of my academic work has to do with thinking about how we mobilize the healthcare community and clinicians in particular to participate meaningfully in addressing the climate crisis. And that means being a source of trusted knowledge and information for our patients. And I've worked with clinicians all over the country on exactly this issue. And I'm really excited to be here today with you to talk a bit about how the Bree report is contributing to those efforts. And what we know is that clinicians are essential in addressing the climate crisis because they see firsthand how it impacts health, from heat-related illness to respiratory issues caused by air pollution. And as trusted messengers in their communities, they can educate patients on protecting their health and adopting sustainable practices in their own lives. And clinicians also influence healthcare systems to embrace sustainable practices and reduce their emissions and advocate for policy change. And this unique position makes them really key players in raising awareness and driving meaningful action around these issues. So next slide. So now when you start talking to most clinicians about an issue like climate change, most of them are just going to ask, well, what can I do about it? That's a huge issue that feels outside of my scope. But the reality is that climate change is making health hazards like heat waves and poor air quality worse for the patients that we serve. And that really is in our wheelhouse as clinicians. The Bree report provides guidance that helps providers deliver high-value, climate-sensitive care by helping to identify vulnerable patients, educating them about heat and smoke risks, and tailoring recommendations to their specific health conditions. And by addressing climate hazards proactively, providers have the opportunity to improve patient outcomes, reduce health disparities, and build resilience to environmental health challenges like heat and wildfire smoke. Next slide. So once again, one of the issues when you try to engage clinicians about issues like climate change is that they feel really far off or removed problems. What they need are concrete tools they can use in their day-to-day clinical work. The resources in this report empower clinicians to to deliver that high value care by directing them to evidence-based tools to assess heat and wildfire smoke risks, such as the CDC's Chilled Out tool and the AmeriCares toolkit. These tools offer actionable guidelines for managing health impacts while providing concrete approaches to enhancing patient communication through anticipatory guidance and community-specific support. And these resources enable clinicians to address climate hazards effectively, improving patient outcomes and fostering resilience to the patients and communities they serve. Next slide. As an educator at the University of Washington School of Medicine with a focus on planetary health hazards, education is really what I'm all about. That's much of what I do here in Washington State. And that means educating our clinicians and our patients about both how climate change is driving hazards like heat and wildfire smoke in our communities, but also about how we can leverage our voices as trusted health professionals to help elevate the conversation about these hazards with our patients. The Bree report emphasizes education as a cornerstone for addressing heat and wildfire smoke risks. It highlights, again, concrete tools like the CDC's Chilled Out program and patient communication resources to equip clinicians with knowledge for informed guidance. By providing tailored educational materials and anticipatory communication strategies, the report underscores the importance of empowering both clinicians and patients to understand and mitigate health risks from climate hazards, fostering preparedness and resilience in those vulnerable populations. Next slide. So the report spends a good deal of time highlighting the importance of an interprofessional approach to supporting patients who are vulnerable to heat and wildfire smoke. Because the reality that we face is that these climate-driven hazards pose complex challenges in clinical scenarios for the patients that we serve that requires an interdisciplinary team to address. I like to imagine a case. You have a 65-year-old diabetic patient with limited mobility and no access to air conditioning where they live, who lives in a wildfire-prone area or an area that often is exposed to a lot of wildfire smoke during the summer months. During heat waves, they experience trouble managing their blood sugar and storing insulin. When we think about how we address a problem like this, this really requires an interdisciplinary approach. A doctor or a nurse can help to screen patients for their risks and the vulnerability that they face. Pharmacists can help to educate patients about storing their insulin safely during heat waves, and social workers can help to connect patients with cooling shelters, smoke shelters, and other community resources to ensure their safety during these events. So thinking about how we work together to address these issues, I think is really critical and something that the report addresses as well. Next slide. So the report also stresses the importance of action plan development. Think about this just as you would, an asthma action plan. The reality is that for issues like heat, we have actually a pretty good idea of who is vulnerable. People have medical, behavioral, and environmental risk factors that we can screen them for and then work with them to reduce their risk. Developing individualized action plans with patients around heat and wildfire smoke is essential for supporting vulnerable patients and promoting their health in the face of these environmental hazards. By co-developing these plans, clinicians can assess each patient's unique health needs and risks, considering factors such as pre-existing conditions, medications, and other social barriers, including access to resources. This personalized approach helps target interventions that are most relevant to the individual, ensuring effective management of potential threats from extreme heat or smoke. And finally, this report also emphasizes health equity by addressing the disproportionate impact of heat and wildfire smoke on vulnerable populations. In addition to the challenges that may arise in addressing these inequities, the report suggests strategies including routine social needs screenings to identify barriers, partnerships with local organizations for resource access, and training staff to provide culturally sensitive care in the face of these climate-driven health hazards. And with that, I'll turn it over to the next speaker. Thank you.
Thank you so much. We'll invite Sara forward to talk more about how health plans can utilize our report.
Thank you so much, and good afternoon, everyone. My name is Sara Warner. I'm the Manager of Community Support Services at Community Health Plan of Washington. In my role here, I oversee the deployment of our community health workers across the state of Washington and every line of business that is served by CHPW. Of note, I am also a community health worker by background and in trade, and as such, I have a unique perspective into the impact of wildfire and extreme heat events on our members and those that we serve in our communities. Our health plan, the main mission is ensuring the health and safety of our members. And as such, these guidelines really help us to meet that mission. Next slide. The plan or the report goes into the guidelines for health plans that include educating our members proactively on how to stay safe and reduce exposure during heat and wildfire smoke events. And that proactive outreach is a large part of what we discuss in the report, that we're getting ahead of the events versus being responsive directly to it. Also exploring mechanisms of reimbursement for equipment that does mitigate the harmful exposure to heat and wildfire smoke, for example, air conditioning or HEPA filters and things of that nature that may not currently be covered under our health plans. And along with that, building networks with our community-based organizations that do provide that equipment, either for free or on a sliding scale, that helps to reduce that exposure. The next slide. I'd like to talk a little bit about how this works within CHPW and how this could work for another health plan as well. So last year during the events, particularly in August and in the summer of last year, we did proactive outreach to our members that were identified as being part of vulnerable populations that we were serving, and provided them with information about upcoming potential heat and wildfire events that included what they could do, the different resources they could reach out to, and how we could assist them. During that time, when the events actually started, we then reached out to those members that were identified in those impacted areas, ensured, along with our case managers and our community health workers, that they had a safety plan, that they knew where to go for heating and cooling centers, that they knew how to get their medications, that they knew how to have an exit plan if they needed to, along with connections to organizations for things like LIHEAP and Habitat for Humanity that could connect them with air conditioning or with filters or any of those items that they may need free of charge, and ensuring that they had those connections. In doing so, we were able to ensure the health and safety of our members in ways that I don't think most people think of when they're thinking about a health plan. And that's one of the really powerful pieces within this report that gives additional tools for health plans to meet our missions of our members' health. And as an example, during this particular event, we had an 84-year-old member. We had reached out prior to the events and had given her information, and she had said, no, I have everything that I need to be able to kind of go through this, and I don't have any issues. But then a couple of months later, after we had done that outreach, she did reach out to our customer service line and said, I remember that you had talked to us about care management and your community health workers. I don't have a fan, I don't have air conditioning, and I can't leave my home because my car is broken. She lived in the Yakima area, and at the time we were facing 110-degree heat waves, or we were getting ready to go into it. We deployed both our care manager and our community health worker out to her home same day. We're able to connect her with those resources for fans and air conditioning, and followed her through that event to make sure that she was safe. And you'll find that throughout this report, the different ways that our health plans can support these types of outreaches. And with that, I'll turn it over to the next speaker. Thank you so much.
Thanks, Sara. Now, we wanted to highlight another resource that exists within our state and supports a lot of wonderful work going on, and really supported aspects of this report as well. Part of what we like to do is just show how one can implement these guidelines, which we've kindly heard from our former work group members, examples how they're using it in in their spaces, but we wanted to uplift and align too with what's also going on in the state and what other opportunities exist and resources. So we wanted to share too that there is in Washington State a group called Northwest Healthcare Response Network, and highlight some of the resources they have to help move this report forward and move the work forward rather on how do we support people during times of extreme heat and wildfire smoke. So I am so excited to introduce Onora and have her come forward, who's the executive director of this network, to kind of share some other resources that exist out there to help our healthcare system in supporting an individual who may be experiencing health impacts of extreme heat or wildfire smoke.
Well, thank you so much, Emily, and thanks to my fellow presenters. This work group has been an extraordinary opportunity to bring together a really diverse group of sectors and perspectives on these really important issues, and it's been a real privilege to work with my fellow presenters here and the Bree collaborative team and other members of the work group on these guidelines. I'm really excited for the work that has come forward, and as we continue to see time and time again, this is more important than ever. I'm going to talk briefly about the Northwest Healthcare Response Network, as Emily said, just as an example, as an organization that some of you listening may be familiar with, some of you may not. So I want to give you a little bit of context about what we do, but also to ground us in as we think about the work that needs to go into the preparedness for extreme heat and wildfire situations and the response. So there are very good things we can do to prepare, and the report does an excellent job of highlighting concrete steps that clinicians and payers and our governmental partners, local, state, can take, and healthcare organizations of different types can take to start preparing for different scenarios that we need to factor in extreme heat and wildfire. Part of where our organization comes in is actually being able to do some of that tangible work with organizations on how you ready your organizations, steps that you take to prepare for the various contingencies, and then through response, when something is happening, be able to coordinate among organizations to support different aspects of that response in your community, across the regions, and across the state, and our kind of broader healthcare ecosystem. Next slide. So just for context, the Northwest Healthcare Response Network, we're a nonprofit organization founded by partners in public health and healthcare here in the Washington state. Our mission is uniquely focused on leading the cross-sector collaboration among healthcare organizations to build resilience, build capability, plan, train, exercise, prepare for, and respond effectively in the face of a wide variety of emergencies. And we know these climate hazards, extreme heat and wildfire being the focus today, often warrant a response that has an emergency response preparedness and an emergency response lens. And we do this in a taking a look at across the healthcare ecosystem and engaging across public and private partners to work on whatever the issues are that we need to address in order to help ensure our healthcare system can address the needs beforehand, before an emergency, and throughout the emergency, working together in collaboration. Next slide. So as an organization, we really focus on kind of four main big areas. One is before, during, and after any sort of emergency, being a center point for data around how the healthcare system is operating from a healthcare system capacity perspective, key impacts that are affecting the healthcare system's ability to provide and respond if something happens. Sometimes we, in the emergency preparedness space, we call that situational awareness. And you'll see throughout the report that one of the key elements organizations can take is to be engaged in ensuring that you have good situational awareness before an emergency, before, as we see wildfire situations emerging or extreme heat situations emerging, making sure you're connected to the best sources of information about how the healthcare system is operating, issues of capacity and other constraints that may be affecting our response are all the types of data and information we collate on a daily and weekly and ongoing basis and coordinate throughout any sort of emergency and response so that our healthcare system partners, in order to provide the most appropriate level of care for individual patients and communities, have good situational awareness about what's going on. We also work on various tips, tools, resources, and the active interagency planning and coordination that helps us bring organizations together to plan, to work together on different organizational plans, how they will prepare and respond together, and knits together different aspects of the healthcare system so that we are preparing not in a silo as organizations, but collaboratively within sectors. So across the hospitals, across the long-term care organizations, within public health in collaboration with their healthcare partners, both within local communities and across geographic boundaries, so that there's really an organized and coordinated effort to get more prepared, take steps to work together, and ensure that when we are responding, we are doing so in a coordinated and effective way. And the tools and guidelines that the Bree Collaborative is rolling out in this case are resources that provide great guidelines to connect organizations to thinking more concretely about the kinds of information you need, steps that you can take to prepare your organizations and facilities for things like the potential need to evacuate. And when organizations are looking at, okay, how do we actually plan for those? Those are things that my organization can then assist with. During a response, we provide kind of real-time support for coordinating hospitals and other healthcare partners across regions, across the impacted areas, to be working with one another on how we ensure we can load balance patients, make sure patients can get to appropriate levels of care, where there are gaps or different additional resources or support needed, support that coordination with public and private partners in more of a real-time way. And then we always are focused on learning from real-world events and trying to improve plans and processes through those. Next slide. So organizationally, we focus a lot of our work at engaging communities throughout Washington State, and most deeply in the areas that are highlighted in green, if you can see color. And we work alongside a partner organization based in Clark County Public Health, who works more closely in the southwest part of Washington. But any organization, any partner within the state is very welcome to get plugged in and engaged. And if you've got an appetite for the emergency preparedness and response work and bring kind of a healthcare and public health lens to that, we would love to be working with you collaboratively as you take steps to prepare your organizations, your providers, and patients to move forward in readiness for these issues. Next slide. As we talk about the impacts of potential extreme weather events, again, when we think through the potential impacts during a disaster, we overlay a lot of the different components that need to be considered in effective emergency response. So our work on any kind of hazard, including these hazards, is always going to take the lens of working to ensure that healthcare organizations can surge appropriately, both from an adult and a pediatric context, working collaboratively with healthcare organizations, make sure patients will be able to get to the right level of care. When volumes may be higher, emergency departments may be busier, we may be seeing divert or other issues, and working in a coordinated way with organizations to try to maximize care for patients, preparing and working with healthcare facilities in the event that they need to evacuate and move patients or distribute patients from around the region, and a number of other steps that help organizations prepare and then respond effectively, regardless of what the hazard is that's driving those things, ensuring that our healthcare system can respond to those. And we see these needs increasingly more in any scenario that we think about from an extreme heat and wildfire perspective. Next slide. So as you all are digesting and partners are digesting these excellent guidelines and looking at the specific recommendations from a planning and preparedness perspective and getting involved with your healthcare coalition, the Northwest Healthcare Response Network represents a lot of that work in Washington, and we are eager to engage and support and partner with the ongoing implementation with our Bree Collaborative partners and want you to be connected. So reach out if you're interested, get on our list so you can learn about planning meetings, training and exercise opportunities in your community, access to additional tools and resources and tip sheets that can help your organizations prepare, and ensure that you're connected so that your organization is, if you're not already, actively getting the good situational awareness, the data, and the kind of real-time response support that will be needed to help ensure all of your organizations and partners can continue to care for your patients and communities.
Thank you so much. I'm going to invite our speakers back on and to share their screen. So we are going to ask some questions, do some Q&A with our speakers. So if you have any questions, please put them into the Q&A box so we can ask them. However, there is one, Onora, I wanted to follow up on a couple things, is somebody just asked, your service at Northwest Healthcare Response Network sounds interesting. Is this a paid service, or would an organization just need to reach out and request a collaboration?
Just reach out to request a collaboration and get involved. We do have organizations through grants and other things that support our work, but it's not a pay to have to be involved. We want folks at the table and leverage the resources and grants that we have to help support that collaboration.
Thank you. And I also just wanted to clarify, because again, I know have some people on the call that are from out of state, and you were showing and we focus on in-state. Did you want to speak a little bit about how other people outside of the state can also be involved in this?
Sure. Well, certainly organizations out of state, if you're interested in connecting to tools or resources or learning more about our work, you can feel free to reach out and we're happy to answer questions. Within your own states, though, every state has healthcare coalitions that are a part typically of hospital and other healthcare organization-led collaborations that are focused on emergency preparedness and response. And we could try to provide some links to help you get connected to those contacts you can connect to and engage with how this work or these issues may interface in work that they are doing locally.
Thank you. I wanted to go back. So in the beginning of our presentation, Chris, you were mentioning how it's kind of a funny time if you're in the Seattle area. We just experienced a snow day. But this is also a really great time of the year to start prepping for our typical and what we're becoming a little bit more used to as our extreme heat and wildfire smoke season. We are seeing within our nation that I don't know if a season is a thing anymore as we're seeing the LA fires occurring. However, I know you and Stefan have been talking about this in the past. How do we prepare ourselves for this season coming? What tools, resources, or advice do any of you on the call have? Can we get ready so we're not in the moment in June or July, August, being like, what now? What can we do in preparation?
Thanks, Emily. I think you know, one of the reasons why this work group I think has been so helpful is kind of jumping off of what Stefan was saying before, is that a lot of people in healthcare kind of are aware of climate change or are concerned about climate change, but may not necessarily be familiar with how exactly it is connected to their everyday work. Sometimes we can be drawn more into a reactive stance rather than a more proactive one. I think helping connect those dots by different audience, by different part of the healthcare sector has been really helpful, so that people can say, oh, so when they, see a warning about a heat wave, they're not just thinking about their own kind of personal safety and preparedness, but they're also thinking about in their professional sphere, oh, this is how I should also be thinking about the people that we serve. And so, we've been building relationships through the work group. There's been awareness raised at multiple levels of healthcare. We had one presentation as an example from the Department of Social and Human Services, which actually does a lot of proactive outreach for the adult family homes and others living in our long-term care settings, some of our most vulnerable elderly patients in the state of Washington. And even kind of knowing that other partners are working on this issue and that there's coordination to be done is really helpful. The example that Sara shared today about that proactive outreach with a very specific member and connecting them to resources, I think is another example. I think many folks sometimes don't know what resources payers have available with regards to either care coordination or other services that can be offered. And so I think that's all part of preparedness, is just having this kind of knowledge ahead of time. In addition to the actual, more other kinds of tangible work, for example, data analyses, they all take time, and certainly seems like work that's underway as a result of this effort.
Dr. Wee?
Yeah, I'll just tag on to that a little bit. I think there are a number of different things that come up for me. You know, I think if you're a patient, that I hope that this report gives you a sense of the reality and why so many healthcare providers are starting to care and increasingly caring about this issue, that it really is a significant health threat. And for healthcare providers themselves, I think that, you know, as Chris was saying, I think many of them, you know, struggle to identify, you know, where this fits into their day-to-day work. And when I think about how we can be preventive and how we can prevent the health harms associated with things like heat, I think there are a couple, there are a couple of interventions that, you know, are fairly well established. Things like, you know, using low-income heat and energy assistance, the LIHEAP program. There are opportunities for people to obtain energy assistance. And yet what we know is that there's this significant gap between eligibility and enrollment in these kinds of programs. There are a lot of people who are eligible, but who are not necessarily taking advantage of those resources. And so having healthcare professionals who can direct people to those resources in advance and have them be proactive as opposed to reactive, which is unfortunately the way that they are used most commonly now, I think would be a really effective solution. In a similar kind of way, you know, heat shelters are another great example of that. You know, there are a number of barriers that have been cited as why are there, you know, a lot of public health professionals identify heat shelters and cooling shelters as, you know, important resources during a heat wave. But we also know that there are a lot of people who could benefit from that resource who are not using it. And one of the most common barriers is just awareness, is, you know, patients are not aware that that is a resource available in their community. And so having, you know, clinicians be able to sit down in advance of, you know, the summer months when it is hottest and be able to come up with a plan. Okay, you know, you are vulnerable in these kinds of ways. These are the resources available in your community if a heat wave happens, including things like heat shelters. I think can go a long way towards protecting people from the worst health harms of these hazards.
Yeah, I think thank you. I want to bring Sara into this conversation too, because you're highlighting the important role of clinicians and what clinicians can do. Community health workers are also such a useful tool in our community settings. How can and how does community health workers really support this proactive work?
Thank you. And I think in a couple of different ways. I think one of the biggest things with community health workers is that we are frequently trusted members of the communities that we serve already. We've built the rapport, we've built the trust in our communities. We're walking alongside the people in our communities that we're serving. And then on top of that, and probably more powerfully, we're also part of those communities. We're experiencing these things quite frequently as well. So I think when it comes to proactive outreach, it's utilizing that trust that we've built in our communities, working with those organizations that are meeting our members where they're at and going, you know, as Chris had mentioned earlier, in February and March, going, here's the resources that you have, what's the plan that you have, making sure that we're getting the education out there before we need it. So it's really kind of getting out ahead of it that is the name of the game. And I think especially when we're talking about care coordination, non-clinical care coordination from a health plan perspective, that's also something as well, is being able to say, have we screened all of our membership for potential social vulnerability? Do we know who these members are that we can get our non-clinical staff out to on a field-based basis and make sure that they have a plan for not just heat and wildfire, but any of the other extreme weather that they may be experiencing. And that can be in multiple different types of settings. So I think it's ensuring that we're using all of the tools that we have across the health sector to identify those that are going to most need it and get the information to them however we can. And community health workers do that every day through health plan promotion or for health promotion and health education. So I think giving them the tools they need and the trust they need to get that information to their communities is pivotal.
Thank you. Onora, I see that you have your hand to join in.
Sure. I just wanted to add, I encourage clinicians and organizations to think about thinking about this much like you might with influenza or respiratory season, or this being a kind of something that we incorporate into our annual thinking and annual conversations and ongoing conversations about key steps that patients can take to protect themselves, helping them understand better their own risk based on different factors that may contribute to that, and not seeing it as a one-off that we should do only if there is potentially a heat wave coming, but integrating it as something that we do as good preventative conversation and care and support for our patient populations throughout the year as just an ongoing additional public health measure that we take, and thinking about those interventions and steps patients can do to protect themselves with the same urgency that we think about getting vaccinated or other things. I'll also just say, and I'd be remiss if I didn't take this platform to say, it's also about your own personal preparedness as providers, as administrators, as public health professionals. You are absolutely vital components in the community to help engage your patients, but also think about your own readiness for those hazards, those circumstances. Make sure you and your loved ones are taken care of and you have a plan for yourselves, and know your own risks and your own strategies if something happens, so that you can also be there to support your patients.
Thank you for raising that. I kind of want to continue on this theme a little bit. So my background is as a nurse. I know we have 2 doctors on and a community health worker. I don't know about each of you. I know in my personal education, I was not taught about this. This was not a topic of conversation. It just wasn't really anything that was in my education. I am curious, as we're talking about proactive and ways to improve, how do we learn about this? How do we see this as part of our role, as part of something that is something we need to know to support others? And what might be one step that you would recommend somebody taking?
I'll kick it off here because, as I mentioned, education is a big part of my role here. So I participated in a lot of education and educational activities for medical students in the University of Washington School of Medicine around planetary health hazards, which is inclusive of wildfire smoke and extreme heat. But what we know is that the reality is that people need this education across the full continuum of their education, and that includes both people who are just getting started in their careers and in medical school or in nursing school, all the way up into people who are already out in practice. And the reality is that most people in medical school across the US are getting sparse, if any, education around this this topic currently. And going back for people who graduated within the last 5 years, it's less and less and less. So most people who are out in practice have had very little exposure to this content and how they can protect their patients around these issues. And so offering opportunities in the continuing medical education space is really, really important. And while I am a physician, and I mentioned early on that physicians are trusted voices and trusted messengers in their communities. The reality is that all health professionals are. Nurses are some of the, if not the most trusted voice in communities all over the US. And so it needs to be, we need to be tackling this in kind of an all-in kind of approach. And so all clinicians, should have some kind of exposure to this, so that they can be aware and be able to protect their patients, but also be advocates for it in their community as well. So I'll end there.
Yeah, I'll say, Emily, one of the first things that I thought of when you asked that question was I moved to Washington State 15 years ago for residency, and we didn't have wildfires every year. I mean, that's kind of crazy to think about, right? Like in the span of like a geological timeline, I mean, 15 years is like not even a blip on the clock. And so, I mean, I think it's kind of eye-opening to just even think about how rapidly the impacts of climate change are accelerating, and how important it is to talk about these things. Certainly for all trainees in any part of healthcare. from, as Stefan was saying, physicians, nurses, pharmacists. I saw there was a comment on that in the chat, and recognize that's actually something that we didn't address in the work group and has a ton of potential, so totally agree. As well as, yeah, community health workers, doulas, all sorts of behavioral health, like peers and all parts of the workforce. Really important to have as part of our training and as an ongoing conversation in our daily work and practice. And I think that's one of the most powerful things in this area, is really just talking about it in your own organizations, asking questions, what are we doing to prepare for the next time this happens, and chipping in and lending some additional energy to those efforts.
I believe we did include a little bit of pharmacists in the
Oh, great.
report
Okay.
under the healthcare professional section. However, I think that's a really great highlight that it takes everyone to really work on this. And there's many different roles within our healthcare system, both a clinician or medical background, but also people who are working at the health plans, working at public health, working out in the field in many different sectors, purchasers who purchase health insurance for their employees too. It really takes everybody, and everybody has a really unique position and role in supporting this issue as it is becoming more apparent, more common, as Chris was highlighting as well. We have a little bit more time, and I just wanted to ask, what change in practice do you hope to see occur by an organization or an individual utilizing the Bree report on extreme heat and wildfire smoke?
I'll kick us off, and I want to specifically address Jillian's question in the Q&A, and I think it's very much related to what I hope to see going forward with respect to how this report can support healthcare providers and health systems in delivering care to their patients. And I think what that gets to is that, and what I think Jillian is suggesting here, is that there are many entry points for us to be discussing this and supporting our patients in them understanding their risks. And I think, again, one of the problems with tackling an issue like extreme heat and climate hazards in general is that most patients have no sense of their vulnerability and why they are actually vulnerable to some of these issues. And that can come from a physician who identifies that, they are on such and such medication, but it can just as easily come from a pharmacist who is saying, hey, I'm delivering this medication to this patient, and, summer is coming up. Being able to have that entry point, to have that brief conversation with their patient and saying, yes, you're on this diuretic. I'm not saying you should stop taking your diuretic, but you should be aware that being on a diuretic during a heat wave can put you at higher risk. And you should seek medical attention if needed, and maybe have a lower threshold to seek attention if needed during that event.
Yeah, totally second that. I think kind of along the lines of what Onora was saying in terms of the many different types of public health interventions that we as a healthcare system should be prepared for. Respiratory season, as an example. I hope that as time goes on, our respective roles in response to climate events becomes part of our vernacular, and both on a systems level as well as an individual patient level. Just totally second, Stefan's, just as you might kind of be counseling someone on getting their annual flu shot, talking about, when you prescribe a antihypertensive or diuretic, talk about, by the way, you don't have to be 100% adherent to these medications when it's 115 degrees outside. And, I've definitely taken care of patients who are dutifully taking their 3 antihypertensives and diuretics and come in AKI and hypovolemic. And I think it's our responsibility to, be aware of the side effects of some of our interventions and the interactions with climate change. So.
Thank you. We are getting closer to the end of our webinar. As we do that, I have one more question, Chris, that I'm hoping you might be willing to answer. Sorry about that. Oh gosh, nope, we don't want to do that. Okay, well. Okay, sorry, everybody. Okay, this is just not wanting to be my friend right now. So I'm curious, sorry.
We're all in suspense.
Oh, thank you. It's not that much, now it needs to be really exciting. After supporting the creation of this report, what are you most proud of in this report? And while you answer that, I'm going to go through a couple slides if you're on the call. We're putting the post survey in the chat if you can complete that, and we're going to share some upcoming events and invite you all to attend that I'll send out via email. But I will let Chris share what he is most proud of on the event of the report.
Thank you. I'm really just most proud of everyone who was at the table. It wasn't a small investment of time from everyone who participated, from our providers, our payer partners, healthcare coalitions, our state agencies, and our clinicians. It was really I think we explored this topic in a number of different ways that, again, is innovative for the country on a national level, and kind of recognizing there's parts of the country that people can't even have conversations like this. And so I think there was just a lot of dedication, energy, and interest, and I think something that Washington has led on in other ways in areas of policy, and I think will continue to. So just incredibly appreciative again to all the Bree staff who facilitated this.
Thank you. We want to invite everybody to join us at some upcoming events that are continuing on this topic. Dr. Wheat and some of his team are putting on a symposium of climate change and clinical practice on March 6th at University of Washington. And then we at the Bree will be hosting a webinar called Addressing the Mental Health Toll of Extreme Heat and Wildfire Smoke. There will be a special focus on youth as part of this. That event will be virtual and free. We also have quite a few other events. We have another report coming out on behavioral health, early intervention for youth. How do we support youth before they experience a mental health crisis? And going to host a behavioral health mini series on those topics. So we invite you in your network to attend those. Again, these events are free and virtual as well. But we really want to take a moment and just thank everybody. We really want to thank our work group members for their dedication to helping develop this report, to Beth Botchkob for leading and facilitating the development of the report as a Bree Collaborative staff member. And also just thank our speakers for joining us today and sharing their time, knowledge, and expertise with us. We are grateful for everybody joining us and see this as a really important topic and hope to continue to touch base throughout the year and raise this. But thank you everybody for joining us, and we hope you have a great day.
Thank you.